So today I'm reacting to TikToks. Yeah, because like, who doesn't love TikTok?
And you're able still to have movement.
Ladies and gentlemen, can I please have your attention?
This video is sponsored by Human 2.0, your trusted source for online training in body weight exercise, kettlebells, animal flow, primal movement, and injury prevention. Be sure to check them out here on YouTube.
Okay.
Hey interns, I'm Dr. Chris Raynor, and I am not your everyday ortho. I make sports injuries, orthopedic surgery, and medical topics easy for you to understand and entertaining to improve your experience with healthcare. Today for Orthopedic Rounds, I'm gonna react to some random stuff from TikTok. Yes, I am on TikTok. So if you don't follow me there, then go do that and ask me anything. I just might answer you with a personalized video. In this video though, I'll react to TikToks and give you my orthopedic perspective. But enough of that. Let's get to the TikToks. Beard is kind of fire though, eh?
So I just got back from the doctor because they told me I have a broken ankle. And as soon as I get home, tell me why my mom sits me down and she said, we're taking that off. She dead ass took off the splint I just got put on at the ER. Like, are you serious? She dead ass took it off. And she dead ass has me soaking my swollen ass foot in this black ass, hard ass, cock-a-looking water. Like, what in the Mexican remedy shit is this? But mom talking about, oh, this water's gonna make the bone regrow together. Like, huh?
No.
What the hell? My foot's
not
swollen.
happening.
Y'all see, I broke it. It is black. But I guess. I mean,
Not
it does
really.
feel kind of good. I'm not gonna lie. What you feel about this thing?
Looked like witchcraft to me.
Exactly. Exactly.
Send some help.
Okay, so my thoughts on this. First things first, if you go to the hospital and we put you in a splint or in a cast, it's meant to stabilize whatever injury is that you have, so you might want to leave it on, right? Trust the professionals. And usually what happens when you are seen and emerge, you're going to be seen by the emergency physician, and then they are going to refer you to the orthopedic surgeon, myself or someone like myself. That takes 1 to 2 weeks. So you need to be stabilized with the splint or with the cast until that time. Bottom line, just leave it on. Clearly this girl is from an ethnic family. I guess she's Mexican. My upbringing is Jamaican. And so we kind of have these old wives' tales or these traditional remedies that we use to fix things. But soaking your foot in whatever kind of water this is, there's nothing in the literature to support that. And although this sounds like something that we would do in Jamaica, yeah, no, that's not gonna work. Don't do that. You know, she asked her brother what he thinks about this whole thing, and he says, yeah, I think that's witchcraft. And that pretty much sums it up. This is kind of witchcraft. So, you know, trust the professionals. We know what we're doing.
And you're able still to have movement.
Ooh,
What's your
giddy up.
grip strength type? So that's actually why it's important that if you think you broke something, you should go get an x-ray.
Yeah, that's a good
If it's
idea.
not reduced and surgically fixed, you
Good
can end
idea.
up with lifelong deformities.
Yeah, that's true. All right, so for this video, we have a guy who clearly has had a fracture at some point in the past, and he is showing evidence of what we call a non-union. So in other words, there's a joint somewhere where there shouldn't be. And if you look, you can see his elbow down below, and just above the elbow by about 4 or 5 inches, you can see that there is another joint or another bend. Because he did not seek medical attention at the time of his injury, the fracture was not properly stabilized, and then it did not heal as it normally would. So apparently this video was taken approximately 2 years after the time of injury, so obviously he has regained some function of his arm. And this is most likely because he has some fibrous tissue or cartilaginous type of tissue that has grown in between the two bones. So although the bone is not completely rigid at this point in time, there is some kind of connection between the two ends. This allows him to use the arm to some degree and to generate tension or force in that upper extremity, despite the fact that he has a arm that is not really contiguous or joined together. I would venture to guess that there's not really a lot of pain that's associated with his arm at this point in time. It's more likely more of an inconvenience. Now, without knowing more about this patient, I'm not exactly sure why it was that he didn't seek medical attention. And perhaps if he was living in the United States, he just may not have been able to afford appropriate medical care. This is the kind of thing that happens if you don't immobilize a fracture properly. So if it's not reduced and the bone's put back in position, and then immobilized for enough time to allow it to heal properly. Normally, this is the type of fracture that would take 6 to 8 weeks, or maybe even as long as 6 to 10 or 6 to 12 weeks to heal. But the bottom line is, if you've injured yourself and it looks like you have a new joint where one shouldn't be, you should go seek medical attention. Get help from the professionals.
Now look at this.
Bam! Yep. So this is a video that I've mentioned before in another video where I was talking about Achilles tendon rupture. So we see here in slow motion that this girl, while she's working out, she's doing some plyometric exercises, and when she lands, she suffers an Achilles tendon rupture on the left-hand side. Now it's really cool to see this in slow motion because we get to see how this injury really occurs. So the important things to note here are that this occurs when she's doing a plyometric or explosive type of movement. And in particular, it occurs during the eccentric portion of the exercise. And that just means that it occurs during the portion of the muscular contraction where the muscle is contracting and trying to generate force, but it is getting longer while doing so. Eccentric contractions are the most difficult type of contraction for the muscle to perform. So it comes as no surprise that this is when the muscle is most susceptible to injury. And we can see that immediately after the Achilles tendon rupture, she has difficulty maintaining her balance and she stumbles forward, falling to the ground. And that's just because now, after the Achilles tendon rupture, she has zero plantar flexion force. That means ankle flexion towards the floor. So zero plantar flexion force on the left-hand side. So basically she's gonna fall to the ground when she's walking. There's a little bit of controversy at this point in time, whether this is an injury that needs to be treated operatively or non-operatively. Both are applicable. But overall, the healing time that's associated with this injury is anywhere from 4 to 6 months. All right. That's a really big dumbbell. This is a large man. Boom! Yep. I like how he plays that off like nothing happened. But this is a problem that's gonna require surgery. So in this video, we have a very large man performing some tricep exercise, some tricep extensions with a humongous dumbbell. I'm not sure how much that is, but I would venture to guess that's probably 120 pounds, somewhere in that neighborhood. So he's performing those behind his head, and he does a couple of repetitions when you suddenly hear a pop, and then he can no longer lift the weight. Fortunately, he was performing this exercise in a seated position and instead of laying down, and he didn't end up dropping the weight on his head, which is a good thing because 120 pounds coming from height onto your skull might be a problem. We don't get to see exactly what his arm looks like in the back portion because he's only showing this from the front, but we can see from the caption that he injured his triceps muscle. And basically the triceps is the muscle that comes along the back of the arm from the top of your humerus down to the bottom of the humerus. It actually inserts on the olecranon, which is part of your forearm, and that's the bone that helps you to extend your arm straight. Obviously, when you're lifting a huge weight, we can see that without this muscle being intact, you are unable to extend or straighten your arm. And if we look a little bit more closely at this video and we look at the timing of the injury, again, we can see that this happens at the eccentric phase of the muscle contraction, just the same as what happened with the Achilles tendon rupture. So as he's bringing the weight down and as he is decelerating, so he is trying to exert muscle contraction to slow the descent of the weight down towards the ground, he now is generating force. And just as he's applying the brakes and he's starting to come back into a concentric contraction where the muscle is getting shorter, boom, the triceps muscle tears right off the olecranon or right at the end of the elbow, and Bob's your uncle. We got a problem. The tendon at the end of the muscle is not able to tolerate the forces, and we end up with a rupture. Usually this is an injury that's not going to heal well without some kind of surgical procedure. To repair this injury, we'll use suture anchors to reattach the tendon to the bone, and overall the recovery from this injury is like the Achilles tendon on the order of about 4 to 6 months. That looks kind of wonky.
Okay, you ready? Press it, look away. Look away.
Ready? Are you gonna be looking at me back or not?
Yeah, she's a little bit nervous, which is normal.
No staring into the doctor's eyes in a romantic fashion. I'm not ready. I'm not ready. I'm not ready.
Slow your breathing. Grab, I'm holding there. You wouldn't let me do this before.
Yeah, but I'm not ready. In. Out.
Give your arms up there. Hold there.
Yeah. Normal breathing. No, not 3, 2, 1. Not 3, 2, 1. Not 3, 2, 1.
3, 2, boom. Back in.
You're doing really, really good. Just breathe. You are. You're doing awesome. You're doing really well. I can feel that. I can feel that.
It's back in
It's
place.
back already. Oh.
There you go. Done deal. All right, so for this video, we have a young girl who has had a dislocation of her proximal interphalangeal joint of the fifth finger. So they're going to perform a closed reduction in the emergency room, and that just means that they're going to give her some sedation, some pain medication, and they're going to put it back into joint. So clearly she's quite nervous because, yeah, her finger's on sideways, and I'm assuming, based on how she's behaving, that she's not had this type of injury before. At this point, they've already given her a little bit of sedation and a little bit of pain medication. She doesn't know what to expect, so she is really kind of ramped up and really nervous. Usually this type of injury is relatively easy to reduce through longitudinal traction and then just correcting the deformity or whatever deformity that is present. So when I see this type of injury, although it looks gruesome, I know that this would be relatively quick and painless. Wow. For the most part, painless. So in order to do that reduction maneuver, we see that he has his assistant putting a little bit of counter traction, which means that they're pulling the forearm or stabilizing the forearm in the other direction while he pulls longitudinally away from the stabilizing force. Now, just a technical tip here. So as he's doing that, he kind of tells the patient that he's gonna, count to 3, 1, 2, 3, boom, put it back into place. And this is a common technique that we all kind of use in order to give the patient some advance warning so they can prepare themselves and put themselves in the right place mentally for this. On occasion, you'll find patients who are really nervous, and this girl is kind of getting to that point, and then they freak out. So in situations like that, what I will sometimes say to people is that we're going to do it on 3, 1, 2, 3. And if I know that it's a relatively simple reduction and I can get it in one shot, we'll count out loud, 1, 2, and I will reduce it on 2, either 1 or 2 before we get to 3, so that it's basically done, because then they're expecting it to come on 3. They're going to be worked up at 3, but they don't realize that you're doing it at 1 and 2. And before you know it, just as he did here, it's back in place. And then they're like, oh, I didn't even know what you did. It feels good. I feel better. Thank you very much.
This is a look at an ankle dislocation after a hole-in-one at the Masters. You can see here
Okay.
the ankle's going to dislocate. Usually it's accompanied with fractures and ligament tears that require surgery. In this case,
Boom!
there were no fractures or ligament tears,
Yep.
and you can actually just pop the ankle back in place, and then you
Giddy
can
up.
get by without
Nice
having
work. So this is a video that I've seen before while preparing for another video that I did about golfing injuries. And you can see here that as he is running, his ankle goes into inversion, which just basically means that the sole of the foot angles towards the inside of the body, and he suffered an ankle dislocation of his left ankle. And to be honest, he is super lucky here that this was only an ankle dislocation and not an ankle fracture dislocation. And he kind of looks down at his foot, which is out of joint, and he is able to reduce it himself on the golf course and then get back up and hobble away. He's able to actually walk on this after he reduces it. So this tells us a few things. So number one, that ankle is probably pretty loose, and most likely he has either dislocated it or subluxed that ankle before. Subluxation being a partial dislocation. It was loose enough that it was able to come out of joint and then be reduced back in joint by himself. It's probably happened before. Having said that, we know that after this injury, that ankle is going to continue to be loose, and it is going to be susceptible to further ankle sprains, dislocations, and potentially even fractures if he dislocates it badly enough. So this is what I would call a wonky ankle. And this is an ankle that would generally need surgical stabilization, some kind of stabilization procedure in order to restore normal functional stability to that ankle. So the second thing to note here is that he is able to walk on this after he reduces it. And this just tells us that more than likely he has not suffered an associated fracture of the ankle when he dislocated it. And we can see him walking off after the injury here, but generally speaking, this is the type of injury where you would want to have some temporary immobilization of the ankle in order to help with swelling and to give the tissues around the ankle a short period of rest. But at any rate, this is something that he should be seeking medical attention for. And if you have an ankle like this, you should be talking to an orthopedic surgeon about getting your ankle stabilized. And remember, any moment is a teaching moment. If you like the video and you want to see another one, then let me know in the comments. Thanks for watching. I will see you for rounds next week. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.